Thank you very much, Petra. Colleagues, friends, as usual, I have far too many slides, so this is going to be rather impressionistic, and it's a long title, as you saw. But what I wanted to talk about is the biggest problem facing public health in the world today, in developed countries particularly, but not only developed countries, increasingly in middle-income countries, which is the epidemic of multimorbidity and polypharmacy. So the birth of homeopathy actually coincided with perhaps the greatest advance in greatest advance in the entire history of public health, perhaps, arguably, the introduction of vaccination by Jenner, 1796, same year as Hahnemann wrote the essay on the new curative principle, 1796. And actually, just for the record, Hahnemann thought that vaccination was the greatest thing since sliced bread. It is completely untrue that the position of homeopathy is anti-vaccination. 6th edition of the Organon, footnote to paragraph 46. Read that and tell me that Hahnemann was against vaccination. He was strongly in favor. His career coincided exactly with the introduction, and he saw what it achieved. And of course, this was about the self-proving of China. And interesting, the wheel has turned full circle, and we'll talk about some recent research on homeopathic China. Okay, so multimorbidity. This is a large and influential study done on about a third of the population of Scotland, looking at multimorbidity. And what you can see here is basically that from the age of 65, on the average, people are multimorbid. On average, people have more than 2 conditions from the age of 65 here. And there's a big effect of socioeconomic deprivation, particularly on mental health. And this is the conclusion. This is not me. This is the authors of this influential paper in The Lancet, the single disease framework, the magic bullet single disease framework. It is obsolete. It has actually become, modern medicine has become a victim of its own success. So many diseases have been eliminated. Unfortunately, many still persist. So what is the solution? Well, we need to reduce medication and treat people, not diseases. This is, the homeopathic constitutional treatment. Just WHO's predictions of disease trends, we're now halfway through this, but a lot of these diseases of young children are going to vanish, but mental disease, you can see the most important thing is going to be unipolar depression, in terms of burden of disease, the amount of suffering it's causing. So these are the areas I think we need to target, and which I'll look at, and indeed which the WHO strategy is looking at: respiratory infection, musculoskeletal, and mental health. Antimicrobial resistance is a huge problem. This is WHO's official estimate of its burden in the European Union to rich areas, European Union, United States, middle-income area, Thailand. Enormous numbers of deaths and huge costs. And this is our British government's strategy for how to deal with the antimicrobial resistance. The problem is that it will only slow down. Unless new antibiotics are discovered, which there haven't been for at least 20 years, there has been no new class of antibiotics for nearly 30 years, actually. No new class of antibiotics, there have been within classes, but no new class of antibiotics has been discovered for over 30 years. So unless that changes, this strategy will at best only slow down the trend. They need new approaches. And we did indeed, when the UK Parliament had an inquiry, we made that point. They need innovative approaches. Adverse drug reactions, horror, pandemic, utter pandemic. And look at this. This is what is really worrying. Doubled in that decade. The incidence of adverse reactions. This is in the US. Things are probably worse in the US than in Europe, but not much. The same trends apply everywhere. Adverse drug reactions, again in the US, more common cause of mortality than road traffic accidents. 40% of liver failures due to paracetamol. Prescribed opiates. This is not illicit opiates. Prescribed opiates cause 15,000 deaths a year in the US. Associated factors, well, we can't do much about this and we can't do much about this, but that we can do. If you take more than 7 medications, you have an 80% chance of getting a drug reaction. Polypharmacy, look at this, 30% of US adults have taken more than 5 medications the previous week. Not much different in Europe. And here we have a tighter definition. The usual definition of polypharmacy is 5 or more. This is 6 or more. So we have this perfect storm, an aging population, chronic and multimorbidity, increasing treatment, increasing adverse reactions, increasing costs. The whole thing is going around in a spiral. So really, I think, we need to start, challenge the magic bullet paradigm and treat the people, not the disease, treat the person, not the disease. Constitutional homeopathic treatment has a lot to say in this context. So just about the evidence, I highly recommend this database. Very easy, free of charge. Just look up core-hom on Google, you'll go straight to it. You don't have to pay, you have to register, but it's free. I looked it up just the other day. Over 1,000 clinical trials of homeopathy, 300 randomized controlled trials. We do, roughly, quite a lot of them are inconclusive for being underpowered. But it's a very useful database. Systematic reviews, 5 now. Roberts is going to talk about the 5th later on in this meeting, mostly positive, and positive for these conditions, particularly allergies and upper respiratory tract infection, which of course is a major source of overuse of antibiotics. This is the Swiss HTA, looking at use of homeopathy so this is the different kinds of homeopathy. The biggest group is individualized, but also complexes. And basically the conclusion is positive, significance or a trend favoring homeopathy, probable. And probable, actually, they had a 3-point classification: probable, possible, unlikely. And so probable is actually the most favorable. And as a result of this, it was put back into the Swiss National Health Insurance Program. EPI-3, this is a big study financed by the industry, financed by Boiron actually, but done completely independently by the Department of Pharmacoepidemiology at Bordeaux. I don't know if it's on here, but anyway, it's done by a good department at a French university. And so there are cohorts. I'll show you some of these cohorts as well. And there are over 6,000 patients altogether. So this is the musculoskeletal cohort. Oh, yes, there you are. So the total number is 6,000. What is that? 6,000, yes, getting on for 7,000 patients. The largest ever study of homeopathy. Shows you slightly different patterns. People under consult, for instance, compared to conventional GPs for cardiovascular, but increased higher rate of consultation, for instance, for musculoskeletal conditions. And interestingly, very importantly in the context of multimorbidity, very interesting, the attitude to participating in their own care. People who seek homeopathy are much more positive about participating in their own care. The question is, what's the directionality? Do they go to homeopaths because they are more keen, because they take decisions about their healthcare, or is it the education they get from the homeopathic physician that encourages them to take more responsibility for their own healthcare? And that is not clear. That needs further study. Probably turn out to be a mixture. But this bit I like, look at this. Now, if you go to homeopathy, you have to be highly educated. Look, big difference in the level of education. People, and across the board, I could show you 3 or 4 other slides which show the same thing. Higher levels of education are associated with the use of homeopathy as a healthier lifestyles. Less likely to be overweight, less likely to smoke. These are, across, again and again, you find it consistently. This is in the musculoskeletal disease cohort. And basically, again and again, the same pattern throughout, actually. The homeopathic patients were as badly affected, but more chronic. They have the same result for half the number of drugs, basically. So this is just to show you. So here, this is the acute situation. This is conventional medicine. This is homeopathy. This is the chronic situation. Again, twice as many non-steroidals. And non-steroidals are very dangerous drugs. We all know about the gastrointestinal side effects, but they are also probably the biggest cause of renal failure, non-steroidal anti-inflammatory drugs. Upper respiratory tract infections, very similar result. Basically, same results for less drugs, less antibiotics, less antipyretics. But there was a slight concern here that there were some possible bacterial infections. And this one is hot off the press. I'm probably not even supposed to show you this. It hasn't been published. It's in press with homeopathy. Will be published any day now. This is the sleep disorder cohort. Same pattern, again. Much less, a lot less psychotropic drugs for the same result. And the homeopathic patients were a lot worse, actually. They had considerably more. This is the number whose standard sleep questionnaire, who had severe sleep problems, nearly double in the homeopathic group. And once again, they're better educated and smoke less and weigh less. Interesting, this is interesting. A lot of them went to the GPs. Basically, they went to the homeopath after conventional treatment had failed. So the less of them rated their GP as the main carer. That's a result. We've already seen that. Okay, this is a study done by David Riley looking at upper respiratory tract infections treated with in primary care, which included homeopathy and which did not. Here, this consistent with what Rachel was telling us just now, much less adverse effects, better response in homeopathy. They did it again with a larger group and very similar results. Although here they only found the adverse reaction different in adults, not in children. But again, very basically the same results. And large scale, wide, lot of different sites. I always feel a bit nervous if Elio is here. This is Elio Rossi's work, just showing that when they started up their clinic in Lucca and they looked at the official state prescribing rates, comparing the patients who attended them with those who did not, the much larger group who did not, they found a big reduction in the specific, so that means the asthma inhalers, but also the other medication, which may have been whatever, sleeping tablets or whatever. Big reduction in the homeopathic group compared to an increase in the conventional group. I hope I can't even see Elio, but I hope I got that right. Oh, there he is. I hope I got it right, Elio. And this is a study done in France. Again, same old story. This is actually interesting. They looked at quality of life, but it's the parents' quality of life. Anybody who's had a child with acute otitis media knows it doesn't do much for your sleep. And basically, homeopathy came out better in every way, particularly the recurrence of infections, and cost the same. But you have the same confounder. The homeopathic parents were less likely to smoke, although they were more likely to send the kids to daycare, which cuts in the opposite direction, which increases the risk. So this is Claudia Witt's work, just showing, very impressive study, very impressive in terms of they followed 7,000 patients over 8 years, big effort, just showing the effect size, but uncontrolled, but impressive nevertheless. This is just to show you the rates, the homeopathy versus conventional treatment in acute otitis media. Very similar rates of cure, but look at this difference in the use of nearly everybody in the conventional group got antibiotics. None in the homeopathy group got antibiotics. That's the prescribing, not very surprising. So this is a complex study done in Ukraine, actually, showing that this was an effective treatment for sinusitis and probably more effective than when they compared it to other comparable studies of antibacterials, higher cure rate for the same cost, and, of course, avoiding the AMR implications, the antimicrobial resistance. Then we're going to have to jump through these. Okay, this is Kusum Chan's work, so again, I have to be careful what I say. But this is adding homeopathic treatment to the standard treatment in India for multi-drug resistant TB. Huge problem. Nearly 9 million people in the world are diagnosed every year with MDR-TB. And another one looking at quinine, I promised you, China, in the adverse effects of anti-malarial treatment in pregnant women in Benin in West Africa. So standard regime plus homeopathy. And homeopathy had better outcome, particularly in the X-ray appearances. I believe now that they're using a standard regime of homeopathy and they have better results still. And that's just to show you the pre-treatment, and this is a pretty grotty, pretty frightening chest X-ray on the left there. This is a study done in Benin, and where malaria is the #1 cause of death, shockingly, responsible for 20% of all deaths in Benin, associated with very bad outcomes of pregnancy. And they basically gave them China, 7CH, or placebo, and showed a big difference in the adverse effects, which of course is associated with improved compliance and therefore improved outcomes. And then this is a bit of a sprint. This is a project I'm involved in. The WHO has a traditional medicine strategy. You can get it online. And they're really implementing it, actually. The most interesting bit is actually the Director General Margaret Chan's foreword, which is highly enthusiastic, very supportive, and we're indeed off to meet her in about a month. Hopefully we're going to get, but already there, it is really biting. This is a really useful strategic thing for us. Important and often underestimated. Homeopathy is popular, just one or two things. I mean, you all know that the French and the Germans and the Indians love it, but the Poles, exactly a year ago, I was in Warsaw, which was an interesting time to be there. It was exactly the 25th anniversary of their revolution, of their solidarity revolution when the communist regime failed. Nobody quite knows how much homeopathy was going on then, but very, very little, if any at all. Now 30% use. When people get the chance, when the people get the chance to use homeopathy, they do. And 50% of US plastic surgeons now use arnica when they do nose jobs. Just little snippets that are encouraging. So just in summary, there's a pandemic of multimorbidity, polypharmacy, adverse drug reactions. It challenges the dominant model of the magic bullet for the single disease. We need constitutional treatment. There are around 300 randomized trials of homeopathy. Mostly they're underpowered or positive. The comparative effectiveness evidence, when you look at the effect of adding homeopathy to standard care, is consistently positive. And the emerging use in global public health problems such as MDR-DB, such as malaria, and the WHO's strategy is an opportunity for us. And finally, a commercial. Thank you very much for your attention.